Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're doing another care plan. So let's get into it. So we have a 21-year-old patient coming in for her first prenatal visit. This is her first pregnancy and she reports feeling tired all the time. She asks you, the nurse, for advice on how to have a healthy pregnancy. So this is not an emergency situation, right? This is kind of like a common situation that you will be put in if you are working in a clinic setting. So it's that kind of care plan. The first diagnosis I chose was deficient knowledge, right? Because it's her first baby, it's her first prenatal appointment. We can't expect her to be an expert at this point, right? So deficient knowledge related to a lack of education and experience, as evidenced by asking the nurse's advice on how to have a healthy pregnancy, right? So she's come here to seek the knowledge, and that's a good thing. So her goal, the patient will be able to state at least 5 danger signs to report to the healthcare provider by the end of the appointment. And there could have been a million different things I put as a goal when it comes to knowledge deficit in teaching. There's a lot of information, especially in that first prenatal appointment. But what I chose was the danger signs, because those are like extra important. Those are things we need to make sure she definitely knows. So what's our intervention? It's to teach it to her, right? So teach the danger signs that need to be reported. And our rationale for choosing that is that it ensures prompt interventions when complications occur. So if something happens, maybe she starts bleeding or something like that, she knows that's a danger sign. I need to call and let them know that's happening. And then we, as the nurse and then the doctor, we can help her with that. And then our evaluation, we can say that the goal was met. The patient was able to identify 5 danger signs that need to be reported by the end of the appointment. And that is a pretty realistic time frame here, the end of the appointment. Of course, we're going to review things with her. We're going to give her pamphlets and lots of instructional materials. So by the end of the appointment, she should be able to tell us the 5 things she needs to look out for. Our second nursing diagnosis that I chose, we had to address this, right? The feeling tired all the time thing. So I chose fatigue. So fatigue related to the physiological changes of pregnancy. So this is normal, right? The body's doing a lot of work, so it's going to make you tired. As evidenced by the patient states feeling tired all the time. So our goal, the patient will state she has sufficient energy to carry out required ADLs by the next appointment. And now this one, the time frame is different, right? This one, we expected her to be able to do it by the end of the appointment. This one, that's not realistic, right? Because she's not going to all of a sudden say, yep, I'm not tired anymore, I'm all good by the end of the appointment. So give her some time to actually work that out. So our intervention is to assist the patient to develop a plan to increase the amount of rest and sleep. And our rationale for this, mutually deciding on a plan increases the likelihood that the patient will follow through with the plan. So instead of us saying, this is what you're going to do, this is what you have to do, working with the patient to develop a realistic plan, they're more likely to follow through with it. And then we can say in our evaluation that the goal was met. The patient stated feeling less tired and more rested at the next appointment. So that was my video on our prenatal patient care plan. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.